Vaccine side effects, what are they? Stay tuned. Hey everyone, I'm Ben. I'm a practicing emergency physician in the Midwest United States. I'm here today to talk to you on the doctor's office about side effects for the new vaccines. Here I'm talking primarily about the Pfizer, Moderna, and AstraZeneca vaccine because those are the ones that we have the most data on right now. I'll be going over what current data has been released about it, what to expect if you were to get a vaccine and the side effects of those, and discuss overall safety of the vaccines. As always, I've gathered the most up-to-date information at the time of filming, but that may be different depending on the time you watch this video. I always recommend you do your own research. This is here just to summarize what we know right now. If there's any questions, follow up with your primary care doctor or the doctor that's been helping you. So will the COVID-19 vaccines have side effects? Yes, you can expect to have a side effect, although not everyone gets a side effect. Right now, we think anywhere from around 30 to 80% of people who get a vaccine will develop some degree of side effect. And hear me out, vaccine side effects are not necessarily a bad thing. It's a sign that your immune system has detected that there's something in your body that needs to have an immune response against it and is building that immune response. And you're going to get some side effects often from that. And what I'm alluding to, what's in your body that your immune system is reacting against, is those spike proteins. The whole reason for the vaccine is so that your body can learn and identify parts of the COVID-19 virus so it can fight it in the future. I made a video talking about how the vaccines work. Take a look at it below. The fact that there are side effects does not mean this vaccine is unsafe in any way. It does not mean that you have gotten COVID just because you have a side effect of the vaccine. So what are the side effects? And here I'm talking specifically about the Pfizer and the Moderna vaccine, who have released their side effect profiles from their safety trials. In the trials, Pfizer's data has indicated that there seems to be about 27% of people who get their vaccine who get some degree of mild side effect. Now that's opposed to Moderna, who in their studies has said that there's about an 84% chance of getting some mild side effect. Does that mean that Moderna is worse than Pfizer? By no means. I got the Moderna vaccine myself rather than the Pfizer vaccine. The fact that there's a little bit more of a side effect profile with the Moderna vaccine should not make you not want to get that vaccine. There's some school of thought that the vaccine that might have a little bit of a stronger immune response might give you a longer lasting immunity. And if that means you get a little bit of a side effect, I'm okay with that. So on to what they are. The most common in both groups by far is pain at the injection site, which just means that typically it's injected in the arm, that your arm is going to be sore for a few days. Not prohibitive. The next is fatigue and headache, followed by muscle pain and chills, and lastly, joint pain and fever. The side effects I just talked about typically are mild and last only for 2 to 3 days. Now there's about 10% of people who will have those side effects last for a week or more. But again, they tend to be mild side effects. And remember, both of these vaccines require 2 injections. Pfizer gets a second injection 3 weeks after the first. Moderna gets an injection 4 weeks after the first. It's more likely that you will get a side effect after the second dose because your body has already had an immune response to the first vaccine, and so that it's going to build a stronger immune response to the second vaccine, which is a good thing. That's what we want. We want your body's immune system to get engaged here and learn how to fight the virus. So what increases the chance that you're going to get a side effect to the vaccine? To put it in a broad category, it's people who have robust immune systems, meaning the side effects, as I talked about, is because your immune system is firing up. So people who have strong immune systems tend to get stronger side effects. Younger people are the people who I'm talking about here. People with robust young immune systems tend to get more side effects than older people. And while I don't have data to back this up, just anecdotally, having talked to other healthcare professionals, because we're the ones who are currently getting the vaccine, it seems that people who have had the COVID virus before get a stronger side effect profile. Again, totally anecdotal. Don't have data to back this up. Me and my wife both got COVID-19, and we have since gotten the Moderna vaccine, and we both had some decent side effects from it. We're going to talk about that in another video, and I'll have my wife on the program for that. It'll be fun, so stay tuned for that. Like and subscribe, hit that bell button so that you don't miss out on that video. Can you quantify how bad the side effects are? Well, I do know that out of the study trials that only 2% of people had side effects bad enough to inhibit their daily functioning. Meaning couldn't get out of the house, just felt so crummy they wanted to stay in bed type of thing. Most of the side effects, mild, can be treated with simple over-the-counter medications such as Tylenol and Motrin. If you have any question about whether Tylenol or Motrin are safe for you, you should talk to your doctor. Then the next logical question is, what about those severe side effects I heard on the news? Now, what they're referring to is something called anaphylaxis, which is a life-threatening allergic response to typically an allergen. You hear a lot about that with kids and people who are severely allergic to peanuts. And what happens here is your body builds up a huge inflammatory response. It causes your blood pressure to drop, and you typically need epinephrine or an EpiPen. If you've ever heard the term EpiPen, it's typically because of anaphylactic reactions. Now, there have only been a very small handful of people who have developed that type of reaction. And in those people, it's typically people who have had anaphylactic reactions to other things. Of the handful of people who have developed that type of severe reaction, all of them have been successfully treated with epinephrine and other medications and have been discharged from the hospital shortly thereafter. No serious long-term effects to date. According to the American College of Allergy and Immunology, you're more likely to have one of these serious side effects if you have prior allergies to foods, latex gloves, medications, insects, than if you were a normal person who doesn't have any allergies. That does not prohibit you from getting the vaccine. I do recommend if you're one of those people, you talk to your primary care physician about that. Are COVID-19 vaccines safe? The answer is yes, they are safe. The two approved by the FDA currently in the United States are the Pfizer and the Moderna vaccines. They're the two messenger RNA vaccines. Link to my previous video down below, which explains what exactly that means. Those have gone through extensive safety trialing and several different phases of trialing to make sure that they are safe. Now, what are these trials? The first is the preclinical trial. And in the preclinical trial, they're taking a look at this vaccine and testing it on tissues, cells, things that aren't human beings basically. They'll do some live animal testing with that and ensure on the broadest sense that this vaccine is going to be safe for organic life. Then that moves on to the phase 1 trial, which typically only involves 20 to 100 healthy volunteers. And in that, they're asking the question, is it safe for those people? Are there any big red flags or side effects? And if there's not, then they move on to phase 2 trialing. Phase 2 are expanded trials, and these involve hundreds of healthy volunteers. They take a look at what the side effects are, what's the most common side effects, what's the safety profile, what's the immune response, kind of get a rough estimate on how effective or not effective the drug or vaccine is going to be. And if boxes are checked off, it still looks safe, it shows that it's going to have some effect, they'll move on to phase 3 trialing. And phase 3 involves over 1,000 volunteers. And in that, they're taking a look at how effective is the vaccine. They continue to collect data during that, though, on the safety of the vaccine to make sure there's no big red flag events that come up during the testing of the vaccine. And then finally, all of that data is submitted to the FDA for approval, where they scour through the data and check off whether or not they think that this is going to be a safe drug or not. Now, with these vaccines, there's been over 1,000 people tested. We're talking tens of thousands of people that have gone through safety testing by this point, and the vaccine is safe. And the FTC and the CDC are having ongoing investigations into safety, meaning they aren't just taking these clinical trials and saying, hey, it's safe, we don't need to look at it anymore. They're continuing to collect data as they roll out the vaccine just to make sure and double check there's no other serious adverse events or side effects that come up. I have received the first dose of the Moderna vaccine myself. My wife has too, as we're both working in the healthcare field. They've been sending out emails. There's a whole checklist that you get when you get the vaccine to say, hey, what are your side effects? Is there anything scary that's come up? So they're doing that on a massive scale now, just to get more data and make sure that it's safe for widespread public use. I'm not a physician who's here trying to sell you on this vaccine for my own gain. I make no money from the pharmacy companies. I really believe that these vaccines are a good thing, and the proof's in the pudding. Me and my wife both thought that this vaccine was safe enough to give to ourselves. I think it's safe enough to give to family members. So me and my wife have been vaccinated. I am recommending my family get vaccinated. I would not do that if I did not think this vaccine was safe. And then lastly, I want to repeat, if you get a side effect from the COVID-19 vaccine, does that mean you have COVID-19? No, it does not. The COVID-19 vaccine in of itself cannot give you COVID-19. To understand why that's impossible, you need to really understand how the vaccine works. And I recommend you watch my video. I did a whole video talking about how the vaccine works. I'll link it down below. But hear me out. I'm not saying that just because you've gotten the vaccine, it's impossible for you to get COVID-19. Remember, after you get the 2 shots in the series from the Pfizer and the Moderna, it's about 95% protective against the COVID-19 virus, meaning there's still about a 5% chance that you could get COVID-19. It's important to still watch after your symptoms. But by and large, if you're developing any of the minor side effects I just talked about immediately after the vaccine's administered, it's most likely a side effect rather than the COVID-19 virus itself. If there's any question of that, I recommend you talk to your doctor and they can review your specific situation and circumstances and symptoms. This video is for information, but it's not intended to make a diagnosis in your case. And I want to leave you just by remembering that even though those side effects sound unfun, and sure, some of them are unfun, it is infinitely better than getting the COVID-19 virus itself. I've been through the vaccine, I've been through the virus. The virus itself is much more unpleasant than the vaccine or the side effects. And if it can help prevent a person from getting critically ill or even dying, then it's worth it. So I'll leave you there. As always, thank you so much for watching The Doctor's Office. I look forward to next time. Like and subscribe if you haven't already. It helps boost me in YouTube's algorithm. Stay happy, healthy, informed, and empowered.